Good morning, everybody. My name is Shannon Etcheverry, and I'm the director of the Turner Senior Wellness Program. Welcome to today's Healthy Living Lecture. We have Dr. Upali Nanda, who's going to be talking with us about brain health, as well as the physical environment. So the title of our presentation today is Environments for Brain Health and Longevity. And so she is coming from us today. She is the Global Director of Innovation at HKS Inc. She's also a professor of practice at the Taubman College of Architecture and Urban Planning at the University of Michigan and an adjunct professor as well. So welcome. And welcome everybody who is here watching live and those who are watching us on our YouTube channel with the Turner Senior Wellness Program. I'll start briefly for those who are not aware about the Turner Senior Wellness Program. So we are a community program for older adults with the University of Michigan Health. We are part of the Community Health Services Department. We are located at the Turner Senior Resource Center at 2401 Plymouth Road here in the north side of Ann Arbor. And we provide a variety of activities and programs for the health and wellness of older adults. Some of that is in person, some is virtual like it is today, some hybrid. So everything from healthy living lectures to exercise classes to cooking demonstrations, technology programs, Medicaid, Medicare assistance. We do have a resource library, a resource center for caregivers, support groups, recreational groups, much more. So if you're interested in learning more, I will put our website, which is mishmed.org/TSWP, our email address, tswp.info@umich.edu, and our phone number, 734-998-9353 in the chat. So a couple of housekeeping things before we get started today. So this is being recorded, so you will be able to view it on the TSWP YouTube channel once it is uploaded. And also a way to communicate with us is through the Q&A. So those of you that are joining us live, we cannot see you, but we can see your questions if you put them in the Q&A. So please put them there as they come about. And I will be monitoring the chat to see if there are any questions as they come along that would be appropriate to answer during the presentation. And if we can't get to them right now, we will get to them at the end of the presentation. So please note that there is an option on your screen to show captions if that is helpful to you. And if you do come up with any issues, feel free to give us a call. So without further ado, I'm going to pass it on to Dr. Nanda, who is going to talk with us about environments for brain health and longevity. Thank you so much.
Thank you so much, Shannon, and thank you for the invitation. This is my first time presenting in this forum, so I'm very grateful for the invitation. I would say that my primary interest is in really forging partnerships in this area. So I'm really hoping that as we talk, we come up with new ideas and innovations and think about what we could do together as a community. So I'm going to go ahead and share my screen. Let me know if you have any issues. And Shannon, I just sent a link that might be interesting to share later on with the attendees as well. Can you see my
Perfect. Will
screen?
do. Yes, I can.
Perfect. So we're going to talk today about environments for brain health and longevity, and in this case, really hyper-focus a little bit on the built environment. I'm a pracademic. I live in practice. I'm the Global Director of Innovation for HKS, which is a large architecture and design firm. And the innovation sector or practice does a lot of strategy, operations, research, and design. I'm a professor of practice at Taubman College, where I teach a course on health by design, and I have the privilege of being an adjunct with HMP as well. I also live a little bit in the nonprofit world, as a director of a nonprofit called the Center for Advanced Design Research and Evaluation, and on the board of directors for the Academy of Neuroscience and Architecture. So this is a little bit about the different hats that I wear, primarily because I believe true change can only happen at the intersection of for-profit, non-profit, and academia. So I'm really excited that you are here today and that we can really think about what, as a community, we could do for brain health and longevity. The key question here is whether design And by design, we're talking about design broadly, design of systems, design of operations, but also the design of built environments can promote brain health to enable healthy aging and quality of life. The WHO definition for brain health is a state in which every individual can realize their own abilities and optimize their cognitive, emotional, psychological, and behavioral functioning to cope with all life situations. It's a really simple definition. Some of the work we have done has really been around getting us to the state where every individual can realize their own maximum potential. These are some key resources that we're also happy to share later on. This first one was just released by the Milken Institute, which I had a chance to collaborate on around shaping environments to shape us, how cities should be designed and thought about in the context of brain health. And then today we'll talk a lot about enriched environments and how homes and our little offices and the worlds we live in can be more enriched. And there are three key components that in this talk today we'll go through. One around enriched environments, what that means for design. And our definition of design is broad. If you are trying to make a change, you are a designer. If you're doing it through the built environment, you're an architect. But you could be an architect of many, many, many things. So for this conversation, we are all going to wear that hat of designer. We're also going to talk about some work we've done with lower income older adults and what it means to have those same kind of goals when you have limited resources. And then we'll talk a little bit about agile dwelling units, which are additions that we can make to our own homes to allow them to really foster brain health, not just age in place, but flourish in place. The first report and work that I'll speak to you about, and the three reports, the QR codes, will let you access them directly so you can download and get a lot more information that we'll be able to share in our limited time together. But the first framework I wanted to share was around enriched environments that promote brain health, foster creativity, and promote positivity and reduce stress. And here the hypothesis is a really brave one. It's a neurogenesis hypothesis that if you have environments that are enriched, you can even create new connections in the brain. So when you download the report, which is actually a workbook, you'll see a lot of ideas, a lot of tools for ideation and design thinking, and the idea of designing for aging across all sectors. So not just in our living environments, but every environment that we touch that is part of our day-to-day life. The way this report is set up, it talks about what the evidence base is with its citations, but it then translates it into key takeaways and then prompts for design specifically. For example, the one that you see in this spread is about allocentric and egocentric perspectives. And stay with me for a minute. Allocentric perspectives are those constituted by objects based on inferences about relationships between objects. So when I walk into the room, I see a window, I see a door, I see walls. I create a sense of the relationship between objects to tell me that this is a room. Egocentric perspectives involve my body or self being in the system and my relationship to them. Apparently, the neuroscience literature tells us that with age, our allocentric processing deteriorates, our egocentric tends to be less affected. So if I have a relationship to place, I have a memory with place, I have memories associated with place, I'm likely to remember it, but I can't just step into a space and recognize that this relationship of objects relates to a home or a bedroom or a restaurant, etc., etc. I need to have a personal relationship with it. Why is that so important in what we are talking about right now? Let me get rid of this annotation. It's important because when we design, we forget that making relationships to place is also important. It's really important in how we design wayfinding. And it's particularly important that as our cognitive processes are changing, It happens to be at a time when we are asked to make the most moves in our life. We downsize, we move into new places, then we go into independent living, assisted living, memory care. And all the time, my ability to process new spatial relationships is actually reducing. So, what I want is to make sure that I'm creating memories with place and creating more enriched environments with them. So, you'll see some of these prompts over here around wayfinding, around creating more spatial coherence. So, even if I don't completely understand, if it's so clear, if it's designed with clarity, I'm able to infer and have more interaction with space, spatial, sensory, or social, that allows me to create a memory. So, engagement with place is really important. The fundamental tenets of enriched environments is environments that have motor components, sensory components, social components, and cognitive components. And we'll talk about that in a minute. But I wanted to share this format because a lot of reports are set up to say, okay, this is what we want you to know. But this is really about what we want you to do. We want you to think about the evidence, think about what the takeaway is, and say, what would you design differently if you knew this information? There are a few key things that we're all aware of. One, that aging is a global trend, it affects all of us, and we have to avoid stereotypes associated with aging. We know that we are all aging. And I know we are a small group, so I'm going to ask this question to everyone who's on the screen right now, that if I asked you, what do you fear most about aging? What would you say? What is your biggest fear about aging?
If you have a comment, please put it in the Q&A. I'll be able to read it there. No responses yet. Maybe nobody's afraid of aging.
Shannon, you're going
No,
to
I
have to
doubt
kick us
that.
off. What about
Um,
you, Shannon?
yeah, I mean, so some people are starting to comment. So, having, you know, not having the same abilities, loss of mobility, loss of autonomy, loss of functionality, being able to function or being independent, forgetting.
Thank you. These are phenomenal, and so many of these are about agency. So many of these are about the loss of agency. And because of that, because of the fears you expressed, and because of what we associate with aging, we have a lot of stereotypes around it. So, in many ways, one of our biggest problems is that we are biased about aging. We have social stereotypes that actively reinforce institutional ageism. There's some really interesting facts like older men who are exposed to more negative health related stereotypes are less likely to seek medical attention out of fear of appearing sick. Like we're so afraid of the vulnerabilities. Loss of control is a great one. Loss of cognitive ability, it's all associated with loss, right? So, reinforcing positive stereotypes that counteract the negative stereotypes, reinforcing a correlation to increase in what we are able to do better or thinking about what we could continue to improve as we age is really, really important. So, positive stereotypes, if you look at the highlighted text at the lower right, using just positive stereotypes, reinforcing positive stereotypes, was actually correlated with increase in older adults' memory, swing time, walking speed, and balance. So it's so important that how we address aging is very with a very positive framing overall. And that's where again the role of the environment is huge. So the shift we want to push towards through design is from managing cognitive decline to actively promoting brain health. That's where we want to go. That's what we see as the destination. We want to counter ageism, the negative stereotyping around aging. We know that there are huge statistics, and I'm sure this group, by the fact that you're present here, shows that you're aware of these, that the population, our aging population, is going to continue to grow. But there are health disparities, there are affordability issues, there is inequity in care and support of elderly family members, there are huge challenges with the aging workforce, and the biggest challenge we have is maintaining quality of life at all ages. we'll skip this poll, but these are some questions I really want you to think about, like without meaning to. Do you sometimes tend to be ageist? I know I do. Do you think aging is synonymous with cognitive decline? And what if we actually said that there are ways, there are means by which we can cognitively exercise our brains just like we physically exercise our bodies to stave off the cognitive effects associated with aging? So here's the second thing that we're going to talk about, that are not all abilities decline equally with age. Speed of processing, memory, spatial ability, and reasoning, these are some things that are particularly vulnerable. So we have to be aware of them. That first example I gave you about spatial coherence and allocentric and egocentric viewpoints, those are really important because they allow us to learn about the vulnerabilities we have and understand that even as some things are more vulnerable, some functions are more vulnerable, other functions in the brain can offset. And that is what the premise of enriched environments is all about. So, first, we need to understand that even though we assume that our abilities, cognitive abilities decline, they don't decline equally. The second component is looking at the framework for healthy aging that includes the psychosocial, the neurobiological, and the environmental. And again, the focus today is on the environmental components, physical surroundings, natural and manufactured elements, the suburban, urban, or rural context within which we live that can have a direct effect on not just the psychosocial, but also the neurobiological. And in that context of brain health, we are actually realizing, we are learning that cognitive activity can constitute a group of protective factors that prevent cognitive decline and dementia. Higher level of late life intellectual activity and performance of everyday activities can aid cognitive decline. So we really need to think about those and say, okay, I know that some of my processes are declining. How do I get into this cognitive gym? How do I keep a level of intellectual activity and performance to stave off the cognitive decline that I fear the most, that came up in all of your responses? So some of the design prompts for us as a community is, how can design features facilitate cognitive activity? How can we support a spectrum of age-related cognitive function? And again, what are some challenges that we do know that we have to be prepared for when we design for brain health? So here are some very simple examples, right? Here's an example of a student housing, actually, which has multi-generational living associated with it, which has a community garden, open spaces. You can see that with open dining areas and rooms where you have a range of activity. And of course, the famous MoMA example, where there's a lot of research that shows that simply being exposed to art can create activation in synapses in your brain that have been inactive for a long time. And this was an experiment that was done with Alzheimer's patients being taken to the Museum of Art. And now you have a series of evidence around dementia patients and what exposure to art can do to start making new synapses in the brain. So very, very fascinating area of exploration of how you can connect to things that are really scintillating, activating different parts of your brain and keep the brain active. We'll skip over this. It's in the paper, but it really talks about the different scales at which you look at the environment and the different individual responses that we think about while accounting for a range of individual characteristics. So it's really important framework to keep in mind. We also knew that during COVID, our seniors were disproportionately affected, and majority, the risk that we run is we will prioritize physical needs over cognitive and social needs. And that is a huge risk because you are going to have more and more social needs and cognitive needs that you need for your physical health. We keep these different silos separate, but they're not separate. And the brain is the cognitive headquarter of the body. So it's really important that we do not ignore our social and cognitive needs as we talk about or prioritize our physical. Here's a very simple example again, right? This is looking at what happens to the body as you age. High frequency sounds are compromised, there's a reduction in eyesight, there's a depressed taste and smell, there's increase in sensitivity thresholds. A simple thing you could do if you look at the enriched environment framework of sensory environments is you can actually focus on multisensory integration and use not just visual wayfinding cues, but auditory cues. You smell and sound a lot more than we do right now to give people cues to where they should go. A familiar sound, a strain of music, you're more likely to follow than just directions and signages saying, turn here. So we are not designing in a sensory way, and there is so much power that our senses depress, compensating with other senses using multisensory ways. And multisensory means have another advantage. People remember music, they remember smells. So, huge opportunity for innovation in that very tiny insight. Social needs, again, a huge plethora of what we could do. Like you're looking at senior living homes that now have kitchens and cafes and dining rooms and a range of options to eat, parks and plazas. And this last one I really love. This is a living room, a waiting room in a senior housing, which has giant Scrabbles boards, right? So you're countering, you're making sure you understand the visibility challenges. So those blocks are huge. But you can play Scrabble and you can play Scrabble on the wall and you can look at it and you can think about words, and that is exercising your brain while using a functional space. So that's some of those creative approaches that we can think about going forward. The fundamental and most exciting thing about focusing on brain health is that the brain is malleable. It can generate new connections through neurogenesis at any age. At any age. And the premise of enriched environments, which again is a very old study out of the 1970s, it has been recreated many, many times. The original study was done with mice, and they showed how mice in a standard environment where you had just the cage, this is what the appearance of nerve cells and dendrites in the brain was. But in an enriched environments where they could be with other mice, they could have a place to play, they could have access to water and more healthy snacks for them. But the social component, the play component, was what resulted in appearance of new nerve cells. And I'll repeat that, the idea that new nerve cells were generated in the mice simply by changing the environment. Simply by changing the environment, we could actually grow new nerve cells if they are enriched. And the components of the enriched environment, which we've talked about a few times, is physical activity or motor, social interaction and connection, sensory components, and then cognitive components, things that make you think, be creative, really, really push your cognitive skills. And that's the premise. The premise is that enriched environments that promote sensory, motor, cognitive, and social engagement can aid neurogenesis and prevent cognitive decline. That is what we as a community want to really push. What if we could create environments that were truly enriched, that were not just about physical mobility, not just about accessibility and grab bars and handles? Those are essential, don't get me wrong. Accessibility and mobility is essential. Addressing motor skills is essential, but so is social connection. So is catering to all of our senses, and so is cognitive connections, doing something intellectual, doing something creative, exercising the brain through design. And that's that push towards brain health that we are making proactively, saying, let's, if we keep exercising the brain, and if the environments we are in help us do that, we will stave off cognitive decline. And I want us to think about the environments we think of or environments for aging that we associate with aging and say, do they really do that? You see that in a Montessori school, but do you see that in a senior living? One of the greatest innovations that I'm most excited about in recent times is intergenerational playgrounds. They're wonderful. Play does that. Playgrounds do that. Playgrounds have all of these components. Why don't we have them for older adults? Why don't we have more of them? Why are they not part of our social fabric, of our environmental fabric? And so this is really what we were talking about in the enriched environment work. And why I wanted to spend a majority of time on this is when you download the report, it has a lot of prompts for you. And we would be so curious to say, what are we missing? How would you do this? What innovations can come out of thinking about design in terms of enriched environments to proactively push for cognitive health? And here's a very simple illustration of what a standard environment, a very vanilla environment might look like versus what a enriched environment might look like. That does have a range, a palette of different experiences so that your brain is constantly engaged. And here's if you did it, and if you did it right, and you did it without compromising safety and accessibility, then maybe you would stave off cognitive decline and the number of people moving into memory care over time would reduce. Here's an example of an enriched environment for rehab, for example, right? So here you're taking care of social needs, physical needs, sensory needs, cognitive needs. It's a simple rehab room, but it's designed in a way that you actually have something for the senses, something for movement, something for interaction, and something even for humor. Humor is a great cognitive tool that you can think through. The last two thoughts on this section are about positivity. That is really, really, really key. We talked about negative versus positive stereotypes. Many of you must know about the dopamine hypothesis, that positive effect influences performances on many, many cognitive tasks. It affects the brain dopamine levels. So being positive, be not thinking about environments for seniors as end of life. Like that has to change. It has to change yesterday. It is about living life. It's about lifestyle, and it's about living life on your terms, getting rid of those fears and actively working towards doing that. So, designed environments to evoke emotions of happiness or calmness or contemplation, environments that provide positive affect, environments that reduce stress or chronic stress. And these are prompts again for all of you to think about, saying, what do you think of when you think of these environments? And how can we see more of these environments in environments for aging? And the last thing, and I find this insight really fascinating, is complex place contexts are really important. I talked about in the beginning about how memory tends to fail, so we need to create relationships with place. So we always think about designing for seniors often as hyper simplifying a vulnerable population that needs our help. But it is about empowering, it's about giving agency. And complex place is really creating positive connections. A complex place is enriched environments that you actively engage with. So you have the enriched environment, but unless you're doing something with it, unless you're creating memories with it, unless you're actively engaging, it's not going to stick. It's not going to become that memory you can really come back to. So we actually need a little bit of complexity. We don't want hyper simple vanilla environments that nobody remembers. We want a little bit of fun and a little bit of joy, a little bit of cognitive flourishing, positive associations, and that can strengthen cognitive activity and reduce stress. So, for example, and I saw Shannon put a link to the MoMA study, like engagement with place via creativity and art can actually create a complex place context. It can create a context that sticks, that you remember. We try to solve for wayfinding. We know one of the biggest things we have is the challenge that often older adults get lost in these big, gigantic places that look all the same. But if you start having them engage with that place differently, if you have a little bit more art and creativity infused in it, it might be a very different ballgame. So again, a provocative idea to throw out there. Shannon, thank you so much for the resources that you're adding as we're having this conversation. So, this is the prompt from a design community to think about memory and place, think about creativity as a design strategy, and think about bringing more of that into our senior living and senior housing solutions overall. And here is the framework for us to remember that enriched environments, which is sensory plus motor plus cognitive plus social stimuli, when added with optimal complexity, don't make it so simple that there's nothing for the brain to engage with. Spatial coherence, because we know that we have some challenges sometimes with decoding space as we get older, and positive association. So enriched environments, optimal complexity, spatial coherence, and positive association, that's what we can do on the environmental side in order to prevent cognitive decline and promote brain health, which in turn will lead to better quality of life, physical, cognitive, and emotional well-being. That's the hope. That's the premise and the promise. So this was thinking about it at a very high theoretical level and maybe getting some juices flowing on examples you can think of, creative ideas that you can think of, and really take that seat, that role of a designer in what we are doing right now. In our remainder of the time, we will go a little tactical. We'll talk about two other projects really simply. One about agile dwelling units for aging in place. And we are actually calling it, instead of aging in place, we are calling it staging in place because it's for all stages of life. And this was work that was done with the University of Texas in Arlington and Cadre and HKS. Again, really thinking about how do we discover and explore this area? What do we test? What do we prototype? What do we deploy? Aging in place is often talked about as the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. We've spoken about this. It's a huge thing. People don't want to move from their homes to go to other residential environments. Quite likely, I would say, because those aren't really enriched environments, and we find a way of enriching our homes that suit us in many ways. And the spectrum of housing that we have is often from community dwelling to independent dwelling to long term care. And as we go into those different settings, our needs for assistance keep changing. So, a big question often is about who do we rely on for assistance? Is that always a human? Can it be technologies? What do we really have to play with? What levers do we have to play with when we think about housing as we age? Some of the barriers to aging in place are cognitive capacities that are declining because our places do not prioritize it today. We don't prioritize our cognitive health. Declining physical capacities and managing health and medication. The shift to staging in place is really thinking about the ability of a person or a group of people to grow within their residence of choice for as long as they're able as they transition through stages of life. So, in this definition, we don't think about it as simply aging. We talk about it as staging from what do you need for a baby, and what do you need when they become toddlers, and what do you need for your young kids, and what do you need when you become a bigger family, what do you need for your older family members? And what do you need when you become older and are on your own? That's the spectrum. Again, we are not excluding aging. We're not taking it out as a separate thing. We're saying this is life. Life happens to include aging. We are all aging. There's a spectrum of needs, however, that we need to think through. From no illness to terminal illness, from active to infirm, from no memory loss to dementia, from having strong social support to no social support, high digital literacy to low digital literacy, community dwellings to long-term care. These are important spectrums for us to consider when we age in place. We have to think about everyday activities. Again, many of you may be familiar with this, activities of daily living that are basic, instrumental activities of daily living that are optional but really important to us, and enhanced activities of daily living like playing music, taking care of our gardens, exercising, that add that measure of a little bit extra to our lives. And that is what I think the enhanced activity of daily livings is where a lot of our work on enriched environments was all about. So here you can see examples like eating, showering, going to the toilet, basic activities of daily living. Instrumental activities are doing laundry and housekeeping and cooking, and then enhanced is things like playing games, using technology in creative ways, exercising. The opportunity that we were discovering here is, can you look at aging within your communities with agile dwelling units? And we didn't call them accessory dwelling units, we call them agile dwelling units, um, because accessory dwelling units are independent housing units. You can add to them, you can add it as a standalone attached home, you can add over a garage, you can add it to the home as an extension, you can add it to the basement. These are all housing solutions that are today in place. We are calling them agile dwelling units because we want them to be not just an accessory, but really hyper flexible for the different needs that you have in your life. So that's the shift from going to accessory to agile dwelling units. Something that can adapt to your surrounding context for every stage in life and can accommodate different levels of ability, keeping that enriched environment framework very solid in our minds. So here again, you see that framework come up. So we think about human factors. Human factors include the cognitive, social, sensory, and motor factors. We think about health technology, construction, and policy. And those three are really important. Are you even allowed to have an accessory dwelling unit? That comes to policy. What kind of health technology do you need integrated into your home as you age? What is the construction components of it? Is it affordable? Can you get it done? What do you need to know? Is your house ready for an addition? And then, of course, key are the human factors that we started off with. So this was also part of a class that was conducted at UT, and this is kind of the model that they had built. And so it's really interesting to see how the construction component of this project came along. It is still not inhabited, but I really wanted to make a push for how important it can be to collaborate with the architecture departments that are within the university to try these prototypes. And Taubman has a phenomenal fab lab that could create opportunities for not only thinking about what the future could be, what kind of units could you add that are truly enriched and agile, and how could you fabricate them and build them and make them and prototype and test them somewhere. And these are some of the ideas that came out of that from the prototyping that they did. These are rendering of spaces. And again, you'll see how much focus there is on flexibility and flex space because life changes. Life doesn't stay the same. We are aging at 15, we are aging at 50, we are aging at 65, we are aging at 90, and our needs will continue to change. So the hyper flexibility needs to be added to the enriched quality that we are seeking, but that enrichment will be at different thresholds as we age. So here are some, again, work that was done by the students on it. And really, you will see the full report in that QR code, and you can go in and read about all the work that was done. But the key takeaway here is thinking about the architectural component, the enriched environment component through the human factors, the health technology, and the policy. So we are scaling up. We're thinking about, okay, what does it take? How do we make this happen? And how do I make it happen in my home? What do I do that can attach or improve the homes I'm living in today? The last very simple call out I'll do is to a project that we did with lower income social adults that was tapping the potential of the built environment. And this is because I wanted to start us really big, think about something we could do today, and then think about what happens when our resources are so limited that we can't really do much, and keep that thought brewing a little bit. And here again, the key issue we took up was the social isolation issue. So we talked about physical, cognitive, social, and sensory. And during COVID, we realized that our social connections were held hostage, especially in senior living communities. And so we hyper focused on social isolation and worked with Presby villages here in Michigan about the challenges with social isolation when you're dealing with an infectious disease outbreak, and how do you resolve the two, which is a key challenge today. Social isolation, we know, impacts blood pressure, heart disease, immunity, stress, anxiety, and cognitive function. And so the question that this research project asked is how can the design of affordable housing environments for older adults improve social connection while being resilient to infectious disease outbreaks? So this is about resilient social connection. In this case, we started with the HUD 202 toolkit, which actually has some credits for health and wellness, and went very basic to how we are given credits, we're given some incentives to produce housing that is physically designed to promote long-term wellness of elderly persons and can provide a robust package of services to support the health and social well-being of elderly persons. This is very concrete now. These are things you get incentives for when you build housing, especially if you're building affordable housing through HUD. And under that, the focus is on fall prevention, visitability, electronic communication and ability, and health and wellness as a big umbrella. And I know that you have done previous presentations, for example, on fall prevention. So those very specific things are really useful because you actually get incentives for them. You get funding from them when you are working in the affordable housing realm. The health and wellness criteria is broad. It talks about building design that promotes physical activity and social interaction, improves the health and mitigates the effect of loneliness in an aging population. Building design can effectively mitigate the spread of infectious diseases. This is what they're looking for. Notice here that there is no call out to cognitive needs. There's no call out to things like art and creativity and other intellectual needs. And this is something that we're really working on because for brain health, to be proactive about it, we need to think about cognitive health too when we talk about health and wellness. In our project, we focused on design criteria and potential metrics for the built environment for affordable independent living communities. And again, the focus was on resilient access to social connection. If your social connection disappears every time you have an infectious disease outbreak, it is a very fragile path to social connection. So the process here was creating a coalition of willing members. And like I said, my biggest interest in ever giving a presentation is to seek partnerships because whatever we need to solve today cannot be done alone. Followed by a lit review, stakeholder engagements, expert engagements, where we talk to a lot of experts in this area, and then a report out. And that's the report you will have full access to. One of the things that we found was really interesting, we did surveys of residents in 2 affordable housing units of Presby villages. Um, and we found that they were actually pretty satisfied with life. Their satisfaction with life scale was high. Their expectations from life were simple and they were okay. Both sides' companionship scale, they also rated high. And on the UCLA loneliness scale, they rated on the least lonely. So, one of the things that we thought was really interesting is a correlation between loneliness and socioeconomic status. And is loneliness more prevalent actually when you don't have that density of cohabitation that often a socioeconomic status dictates for you? This is a hypothesis, we don't know. But there's something that I found was so interesting that we were expecting perhaps a more negative result than that we found. They were not very lonely, they were reasonably satisfied, they had high companionship, they were doing okay on the social connection scale. They used community rooms, they used lobbies, and the community room stopped being used as soon as COVID happened because it didn't have enough adequate ventilation, like a really, really simple thing. But we also found that frequent use of the community rooms was associated with improved companionships. So if you have area for people to come together, the use of those areas can be a predictor of improved companionship. Same thing with the frequent use of lobby being a predictor of improved companionship. We ask questions about what spaces do you actually feel safe in? And safe and accessible walkways came up, spaces that were close to the building, close to social activity, visibility came up a lot. defined outdoor areas, and then protection from the elements. These were some of the components of safety that came up a lot. And you can see some of the images in the background of this text of spaces that people did feel safe. What spaces were used to get together with friends and family? Um, we asked about this question before the pandemic, during the lockdown, and then now, which was a few years ago. Um, and where you see the biggest drop between before the pandemic and during the pandemic is in the lobby spaces. Outdoor spaces stayed relatively even and increased in use a little bit. And then in individual apartments, there was a little bit of the shift too. Individual apartments remained the least used for people to get together, which was a big issue. That people were not inviting people into their apartments, and there weren't enough public spaces that were safe for them to meet each other. The outdoor spaces at community room during lockdown started getting down. Hallway is something that we realized was used most frequently during lockdown. And hallways are underutilized opportunities. They're really, really key opportunities that we are missing. If we designed our hallways better, if we had a little bit of range in our hallways for different kinds of social interaction, it would be a huge innovation opportunity. One of our biggest takeaways was about the laundry room. So overall, the most popular spaces for people to get together were the community room, laundry room, and lobby. And like we said, that changed a lot. But the laundry room was a functional need. And so people kept using the laundry room even during COVID. And that's where they met others and they talked and they caught up. And so that has a big light bulb next to it. It was a huge insight for us. It's one of those spaces of daily living that we could do so much with. It could be a portal to some creative exercises, it could be a portal to health information, it could be a portal to social connection, digital and physical. So, one of our big aha moments was about the power of this tiny little room. If that room could be well ventilated, if that room could have a little more opportunity for excitement in it, maybe we would meet a lot of diverse outcomes. Some of the questions we asked was, how do you prioritize? Like, if you're a person who has very little money and is trying to do what's right for a housing development, what do you prioritize? What gives you the most bang for the buck overall? And that was what a lot of our work then went into. It included a range of experts in this topic that we started talking to and saying, okay, where is your head at? Like, how would you prioritize? And here are some of the key factors. Very simple. This is not rocket science. Good ventilation, comfortable seating, convenient locations, ability to get outside, large and easy to open windows, enough space to socially distance, views of nature, and flexibility. And the priorities between residents and stakeholders, the enough space to distance, good ventilation, and really came up a lot. Comfortable seating came up. And flexibility is something that we found coming up as an important thing for stakeholders who were putting in the money because we need so many different things from our places all the time. So, again, there's an entire list of things in the report, which is very tactical, gets into specific things you can do. But we put little heart signs next to the outdoor patio and community room. Again, really simple. But if we had more community rooms that actually had outdoor patios or a way to get outside, and I know in Michigan that's not many months of the year, but the months of the year where the weather is great, how much would it take to create more breathable thresholds so you can actually be outside, be safe, and be connected? So, key barriers and challenges is really around no surprises. The first one is funding constraints and limited access. The guidelines currently don't ask for things in a more nuanced way. We really don't have a broad range of user perspective, and there is a massive lack of education about the connection between the built environment and social health. We know it promotes it, but the evidence base is still lacking. So some of the key takeaways from this particular study was the built environment can contribute to social connection. Top three spaces for residents are outdoor walking paths, patios, and community rooms. Interior features are about space to distance, ability to get outside, and good ventilation. And when you're not worried about the pandemic, you replace that with comfortable seating. We also think that the HUD guidelines need to be changed a little bit to prioritize some of these non-negotiables. Once you get the non-negotiables in place, you can think about higher level of enrichment. And this is what you will see in the paper that is again very, very tactical. It talks about specific design features, how they relate to social connection or safety. Do they relate to indoor or outdoor spaces? Do they come from a review of the literature, field research, focus groups, or surveys? So I will stop here and take questions. We kind of covered a big breadth. We talked about enriched environments and how we can create new connections in the brain. Then we went into what you can do in your own spaces with agile dwelling units and attached to that. And then we talked about affordable housing and how you can design for aging in affordable housing, um, which is a lot of content. And then again, like I said, the reports for each of these will be shared with you, but I'd love to take questions and have a conversation at this point.
Thank you so much. That was very informative. I learned a lot. I have some questions. So if you have questions, please put them in the Q&A, but I have a couple myself. So, if we have anybody that's watching this that is, going to be moving into assisted living, or maybe they're looking at memory care for their loved one. I know that you mentioned the importance of community spaces and some of the other spaces, but do you have any in your mind some top things to look out for from a design perspective, or maybe something that might be a red flag that the space isn't designed well?
It's a great question, Shannon, and we're actually working a little bit with AARP. AARP, by the way, has a brand new brain health action collaborative. They have established where they have brought designers, artists, scientists, policymakers all together. If you Google Brain Action Collaborative by AARP, you'll get a chance to see that. And part of that is informing members, informing older adults about what to seek. And that's the question you're asking, right? If I move into it, what am I really looking for? Because the brochures are always shiny and they're always wonderful. And the intent of most operators and providers is spot on. So my recommendation would be to look at the baseline things that we talked about, right? Like look at your activities of daily living, your instrumental activities of daily living, and your enhanced. You think about those and say, am I going to be able to do that here? You think about the enriched environment framework, and it's so basic, but it's so powerful. You say, okay, let me think about movement, physical mobility. Can I move around the way I need to? How much freedom do I have? How much space do I have? How is that going to look when I'm in a wheelchair, when I'm using a walking stick? Like as I age, am I still going to be able to move freely and do things? Is it going to promote my physical activity? Do they have outdoor walking pathways? Do they have covered walking pathways? Can I get enough exercise the way I want? And that will change over time. Like today, I might want to go to the gym. 5 years from now, I just want a leisurely walk. And so, again, thinking about movement across that continuum. Sensory is another great one, saying what is really exciting my senses? Do they have environments that make me feel good in a sensory way? Are there gardens I can spend time in? Is there a place I can go? Kitchen is huge. A kitchen, a functional kitchen where you can do things and cook and smell food and smell other people's food. Um, that's really important. So the access to good food, nutritious food, ability to cook food, that's another thing you look for. I think from the cognitive side, learning opportunities, creating opportunities. We don't look for creating opportunities, but what am I going to do for fun? There has to be a lot about celebration and fun in wherever you go. And that's why I was saying that the narrative of thinking about it as an end of life is very flawed. It really should be about the flourishing years where I have more agency to do what I really want to do in some ways. So I think that component of creativity and cognitive engagement and then social connection is where am I going to meet people. And that's a really big one because you have to think about it in terms of where do I meet my family, where do I meet my friends, where do I meet other community members, and how do I go out to meet them? What's around me? One of the things we didn't talk about at length today is location. But location matters. Where are you located? What's located around you? What else is in that zip code? And how are you getting there? What are the mobility pathways to getting there? So, that enriched environment framework, I think, helps in thinking through that. But you don't just think inside the building, you think about the building's connection to the neighborhood and the city, which is also really important.
Thank you. Yeah, a piece that you talked about really resonated with me when you were talking about staging in place and
Hmm.
talking about that spectrum, that thinking about, like you said, aging is not its own isolated part of life, that we are making adjustments all the time based off of what stage of life we're in. So
Hmm.
I just really enjoyed that, and that really hit home for me. So thank you for that perspective. We do have
I,
a question here, but if
uh-huh.
you want to say anything before I move on.
No, I was saying I appreciate that because we are now a multi-generational family. Like we have our young kids, but we also have our parents living with us. And I see how important it is and how many things I used to think about for my young toddlers, which I now think about. And it's the same thing. It's about remove clutter, make it easy, really think about where you want the level changes. It's the same thing. So if you think about staging in place, you will actually meet for varying needs in life rather than just staving it off for end of life.
Well said. So, question from Janet. So she says, I'm looking into future congregate independent living for myself here in Ann Arbor. Could I suggest to administrators that they contact your organization for ideas to improve their facility? Do you have people who might visit the place?
100%. I would raise my own hand to do that. Like there, I think there is no replacement for field research and going on site. And 100%, I think we notice so many things. And what is really fascinating is you notice things that can be easily fixed. Not everything is a massive change. So yeah, absolutely, I'd love to.
Great. So we do have a comment. So someone did say, thanks for presenting the big picture overview about quality of life as we age. The art focus is so important. So
Thank you.
any additional comments about art? I know from my experience here at the Turner Senior Resource Center, we have an art gallery. We have one of our programs does painting classes. We have an adult day program that does art. So that's near and dear to my heart. But anything from your lens that you want to add about art?
I We can't underestimate it. It is one of the things that is so powerful, and we don't think about it because we don't think about it as an essential. I think art is essential to our brain. Creativity is essential to our brain. We thrive when we make something, when we think about something. So I'm glad that you're doing it. There's a phenomenal initiative from the John Hopkins group right now called the Neuro Arts Movement. They've just published a new book on your brain on art, which talks about how your brain physically changes by exposure to art. And that's a movement that's creating a lot of traction right now. So I think it's one of those things that part of what makes us human is our connection to art. it our desire for something more than the basic. That's what makes us human. We have to celebrate it. And I feel I didn't touch on it enough, and I think it's a key component of what's enriching. What's food for the brain? Art is food for the brain, just like your veggies are food for your body. Well, actually, my neuroscience friends would say that's wrong. The veggies are really good for brain health too. So I'll take that back. Vegetables are good for body and brain. But art is something that really, really feeds your brain. It really gets new connections in your brain going.
Absolutely. I'm curious, this is a little bit of a shift, but not too much. What about the use of color? Are there any, if someone's designing their home or a room or a space, are there any do's, don't do's when it comes to use of color?
So color is probably the most complex in terms of design recommendations. It is really complex because color depends on lighting. So how you view something is not just what the color of the object is, but the light that falls on it. And if you have yellow light or white light or daylight, completely different. Um, I know that there's a lot of things on moods and how colors is associated with moods. I find it an evidence base that is still emerging. So overall, I think use of color is great because color allows you to put variety. It allows you to have these components that are interesting to you, but it's highly subjective, and that's okay. So you'll have some specific things like you will say about use of yellow or too much monochromatic. It actually makes it difficult to see diseases sometimes. So there's some very basic things about colors that we try to avoid or keep to, but the big things about purple is going to improve your mood and this is going to reduce your mood. I personally don't think that the evidence base is so compelling that you can make color recommendations. So the very simple thing I would say is it's a creative tool too. If you enrich your environments and you design your environments and you look at the wall as a canvas, not a wall, then express yourself on that wall. Ask people what they want. Try out different colors with them. Experiment with it. Don't make it a static thing. Make it an engaging thing. But we probably are not at a point where we can prescribe certain colors over others. They can be great agents for creating some creativity in the room, and people have different color preferences, and they should be allowed to really celebrate those preferences.
Thank you. Just to kind of piggyback off of that, and I know that there are some recommendations for individuals with dementia specifically, that if they have changes in their vision where there may be a a floor mat or a rug that in their mind is perceived as a hole, or
Mhm.
something that changes in their vision. Is there anything specifically that people should be looking out for if somebody has dementia versus someone that does not?
I think that's a really key component of it. And what you're talking about is contrast. Contrast is really, really important. So you start having these perceptual, um, like even lines on the flooring that can feel like a level difference. You have to be very careful about that. The kind of patterns you choose about flooring, you have to be really careful about that. That I think is a very compelling evidence based on in terms of patterns, legibility. Like this, I talked about spatial coherence. Another term that comes up in the evidence is legibility. Like how do you make your environments legible, especially with diminishing eyesight over time? And that is very much part of the work. That is where color can be very useful, is defining edges in a way you can see that there's a separation and you don't trip over things and you don't lose your way. So I think it's a powerful wayfinding tool. It's a powerful navigational tool. You can use it in many, many ways. We're just not at the point where one color is, say, better than the other in any objective way. But I old enough now to know that probably someone somewhere has a very compelling body of evidence that I may just not be exposed to yet. So I would keep that light filter in my mind. But I think you raise a really good point. And that body of evidence around contrast, level differences, how do you design for those basic things is in place. I have a colleague, Dr. Maggie Calkins, who does a lot of work in that space, and some of her work would be a great reference.
Thank you. My next question. So, if someone is building a new home, or maybe they're doing a renovation of one room in their home, a bathroom, a kitchen, what advice do you have for them to make sure that that home is designed in a way that works for their needs?
You know, we start with space. That's the problem. Don't start with space. Start with experience. Start with exactly what you want to experience and articulate it. Designers will appreciate it. If you say things like, I want to wake up and then I want to do this, and this is what my day looks like, and this is what I want to do in my day, and I want to be able to get from here to here without doing this, and I want to have enough space to do this, and I want to have um, enough views to enjoy this, like be very experiential first. It's really important. We don't do that enough. We don't think about, okay, think about a day in your life. What does it look like? You're going to wake up and do what? Think of a day that is not typical. You're going to do what? What are you going to do? What does that look like now 5 years from now? What does it look like 10 years from now? Start with the experience. Then think about the outcomes. Think, what do you want to feel? Like, what are the outcomes of what you want? You want to be safe. You want to be comfortable. You want to be surprised. You want to be, you want some elements of delight in what you're trying to do. Like, what is it that you want? What's the outcome? What is going to make you feel really good? Articulate that. Then get to space, because then you can start saying, how much of the space that I really need for my toilet? What do I need in my vanity? We're doing this work on with FDA that I think I put a link. Um, Shannon, I don't know if it went to all of the audience, on designing the home as a healthcare hub. That's work where we're doing where the FDA is asking the question of what happens if you can meet all your diabetes needs in the home. And they're starting with diabetes, but their vision is that the nexus of healthcare can move to the home with the level of technology we have. It makes a really fascinating premise of what do I need from the home if that happens. Now it starts changing. I want consistent power. I want consistent internet access. I actually might want a more open layout, because an open layout helps me with mobility. It also helps me with having more Bluetooth connectivity between devices. Right? It's a very simple thing. But when you think about what do I want to have telehealth visits. I don't want to drive 30, 40 minutes. I want to be somewhere walkable and do this. Once you put that in those experience terms, space follows. If you're going to start with saying, I want a 10 by 12 bedroom and I want a X by Y bathroom, da 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 da, you're not starting at the right place. That's the biggest mistake we made. You talk to a designer, they will translate those experience needs into space needs. And then they'll ask you, what are you doing? Are you a person who keeps their medicines in the vanity? Do you do your daily care there? Like, what is happening? What is the scenario in each of these spaces? What are precious to you? And you deal with it. And I would say that that's the biggest difference between you selecting a pre-made place as you would in a residential development, Shannon. Like if you go to a neighborhood or a community, you're looking for things. But when you are adding to your own house, you are creating things. So don't aim small, aim high, and you'll be surprised at how much when you aim high you can do for lower cost, because that's design challenges. Design is about doing more with less.
Thank you. Are there any certifications or specializations that people should be looking for if they're working with a designer, an architect, a contractor, to make sure that they are aware of looking at it with this aging lens?
Mm, that's such a good question, Shannon. I don't know. Um, that's a really good question. Like, I know that there are many, many avenues and there's a lot of expertise, but I might come back to you on that one. I'll ask some of my colleagues. I'm sure there is. Environments for Aging is a platform that does a lot of work around this. The Center for Health Design does a lot of work. So I'm happy to create a cheat sheet of resources um, that you can look at, but I don't know of certifications that are particular around it. But again, that might be a gap in my knowledge, not that it doesn't exist.
Yes, if you can send some of those resources, that would be wonderful. And we also just so for those are aware, we also have resources here at the Turner Senior Resource Center. So for example, if you want to get your home checked out to see to do a safety assessment, Catholic Social Services does that, or they will look at potentially installing different safety devices in your home, like grab bars and things like that. So there are programs and resources where maybe you don't need a total overhaul, of your home. Maybe there are a couple modifications that can be made for safety, but those resources exist. So you can always give us a call or come into the center if you want to learn more about those things.
That's wonderful.
Yeah, so I don't see any other questions in the chat. Someone did say that they volunteer at the hospital and the art there gives them a lot of enrichment. I want to thank you again for spending your time today with us. I thought that was extremely informative, and I really appreciate your perspective and looking at things in a big picture and looking at music and art and socialization and humor and not just the physical space and how those things all interact. So I really appreciate it, and I learned a lot today, and I think that others did as well.
Thank you so much, Shannon, and thank you for the invitation. And thank you so much for those who asked questions. Yes, absolutely reach out anytime if we can help. And Shannon, we should set up some time. I'd love to know more about the center too.
Yes, absolutely. That sounds wonderful.
Thanks,
Thank
everyone.
you so much. I hope everyone has a wonderful day.
As well.